Hi, my name's Reba,
And my name's Troy,
and this is our final case study on assisted living.
with memory care.
Assisted living with memory care is designed for those who have dementia, Alzheimer's, and other memory-based impairments. Within the increasing geriatric population, assisted living facilities are becoming increasingly prevalent. These living facilities allow patients to live in a safe and health-promoting environment that feels like home. The use of activities allows it to feel like it's home while increasing their quality of life.
These type of assisted living facilities aim to combine both form and function to the people who live there by combining a home-like environment, numerous activities, and life enhancements for those with memory impairments. Several services are offered. For example, independent and assisted living are the two primary services. Other services like memory care, personalized care, nutritional services, 24/7 licensed nursing care, physical and occupational therapy, diabetic care, non-ambulatory care, and a variety of other support groups and educational groups for family and caretakers.
Occupational therapy is one of the services that are offered at assisted living facilities that we are most interested in. The occupational therapy works to improve patients' quality of life through activities and meaningful occupations. Using occupational therapy, assisted living facilities integrate specific activities and interventions that are appropriate for the client's overall functionality. These activities are meaningful and add to the home-like quality of assisted living. Some examples of occupational therapy activities would be showering, making his or her own bed, getting dressed, doing his or her own laundry, and eating meals with others, maybe even preparing the meals if this is offered at the facility.
This type of assisted living facility is home to thousands of different clients with different disorders. In our case study, we analyzed a 79-year-old female who presents symptoms of early stages of dementia and a previous hip fracture from a fall in the kitchen a few years ago. The client is still currently struggling with this hip condition. The client is also very family-oriented, has a daughter and son-in-law that visit at least twice a week and participate in caregiving activities along with therapeutic activities. The client is extremely motivated to learn new skills and improve independence. The client would like to maintain her current cognitive functioning to continue with hobbies she previously enjoyed, like gardening and cooking.
There are many models that can be used to design treatment plans for a client. The one that we thought would work best for the client is the cognitive model. It is typically used with clients with memory impairments and deficits. There are many ways that it can be used in an intervention, but it could be used as a maintenance intervention that maintains the function of the cognitive processes. This allows the client to maintain the abilities that she still has. Another intervention is the compensation method that aids capitalization of existing potentials. This focuses on the client's strengths to overcome the limitations. The cognitive model can be used through process-oriented and dynamic strategy learning, specific skill training, and task and environmental modification. This client specifically focused on specific skill training.
According to Kielhofner in 2009, multiple models can be used in congruence to better fit a client's disorder or diagnosis. The biomechanical model and the cognitive model are used in congruence because a client suffers from dementia along with a broken hip. More specifically for the biomechanical model, this is used for clients with impairments to the musculoskeletal system. There are three specific ways in which the biomechanical model can be used: restoration, maintenance and prevention, or compensatory. Restoration can be used to increase available motion, strength, and endurance. Maintenance and prevention helps maintain the function of the musculoskeletal system. As a compensatory approach, this used offset limitations presented by the client in stability or motion.
After determining that the cognitive model was a good fit for this client, cognitive assessments were used to determine the limitations that the client faced and that could be addressed during occupational therapy interventions. Assessments that can be used with a cognitive model are observation during task performance, interview of client and family, and standardized tests. Example of an observation during task performance is the occupational therapist having the client cook or garden, or a simulation of these activities to see what cognitive processes are affecting her abilities. The interview of the client is very important to determine what she feels that she needs to work on and what she finds meaningful. The interview of the family in this case would be important as they are very active caregivers and they need to address with the therapist what they find important. Standardized tests are used to compare the progression of the client's impairments to other clients with similar diagnoses. These assessments can be used alone or in combination to gain a complete picture of the client.
Along with cognitive assessments, biomechanical assessments are necessary because of the lower extremity injury that was implemented on the client during her fall in the kitchen. Standardized measurements are used in regards to range of motion by using a goniometer. The goniometer allows therapists to calculate the exact degree of the client's joints to measure progress over the course of time. Observing and performing manual muscle testing allows the therapist to measure the effectiveness of the muscle in relation to manual resistance and force. To observe endurance, a dynamic and static approach may be used. An interview of the client may be necessary to determine the safety concerns of musculoskeletal impairments. An interview of a family member can also take place to gather additional information. In regards to the theory of the treatment plan, treatment intervention will be similar to that of physical therapy due to the cognitive and biomechanical components. Although physical therapists might use these same models, occupational therapists use them in a much different manner. Occupational therapy aims focus towards clients' return to desired occupations. This is done by focusing on what the client finds meaningful and his or her goals along with the occupational therapist's input. The overall construct of the treatment plan not only aims at improving functionality, but doing so in a manner which re-engages a client into life roles and routines.
Using the cognitive model and the biomechanical model and the assessments that go with them, the treatment plan was created for the client. The first focus of the treatment plan was on the dementia symptoms that affected the client's ability to partake in activities that she finds meaningful, such as gardening. The client relayed to the occupational therapist that she faces the issues such as forgetting some steps, forgetting to care for the garden on some days, and sometimes losing motivation due to frustration. The intervention focused on skill abilities that would be needed during gardening. The therapist set up a kit that includes all necessary equipment for planting and watering so that steps are not missed because all objects are together to remind her. The therapist also set up a schedule that the client could set in a well-seen place that she could check off each day that she cares for her garden so that this would allow her to not forget. These two aspects combined should ease the client's frustration and therefore improve her motivation to continue these hobbies. The previous hip fracture that affected the mobility was also addressed in the treatment plan. The family and the client said that the issues she faced were a limited range of motion when walking and when reaching for objects. They feared for her safety whenever she was alone. The intervention focused on implementing the use of a walker to improve safety, continuing to exercise the range of motion and activities of daily living that were necessary for the client, and educating the patient on the use of a grabber and sock aid and other adaptive equipment that was needed along the therapy sessions. All of these together allowed the patient to be more independent and improved her quality of life, as occupational therapy is meant to do.
In regard to client results, the therapy services are required to report if the client has improved, declined, or remained the same after following occupational therapy sessions. The occupational therapy services offered can aid in reporting the change or maintenance of the client's cognitive abilities, safety, and musculoskeletal functioning. This outcome data overall can be utilized with future clients who present with the same symptoms or diagnoses.